Hi, I'm Dr. Patel. I'm the psychiatrist working here in the behavioral medicine department, and we are here today for a CareConnect seminar. Okay, well, good afternoon. Thanks everyone for joining us today. I know while we're working on the audio, y'all may be able to hear me. So I'll go ahead and start. Today we have many questions. One of them was, we understand that these are stressful times. So how does the body react to these stressors? So in light of recent events, whenever there's stress, your body, you may notice like tension in the muscles and the neck. Sometimes you may notice stomach pain or aches or cramps, also sweating. For some people, they can feel their heart, pounding a little bit. So you do have a lot of hormones that can be released whenever the body encounters stress. These are usually like cortisol. And what cortisol can do is it can make you, feel more antsy, crave, certain things like sweets, and then want to eat food and things like that. So we'll talk about some ways to manage stress. So how can somebody differentiate between a general stress response and an actual anxiety and panic attack? So stress is natural. We all have it. If you were to put a tiger or a lion in the room, we would all start sweating, and maybe, our breathing rate would increase, and you might get a little tremors or shakes. But whenever your body is feeling that stress and the lion is kind of taken out of the room, or the tiger is taken out of the room, that's kind of when it's more of anxiety and panic. So, for example, anxiety attacks can be where your throat closes up, heart is racing, you get short of breath, chest pain, feel like, weight on your chest, shakes, and chills. A lot of people say it feels very uncomfortable and you feels like you don't have control. And those may be more along the lines of an anxiety or a panic attack. So we'll go over some ways to mitigate those as well later.
I'm
Hi.
sorry about that. We
It's
had
okay.
some issues with my microphone not picking up. So thank you for joining us. And everyone, I'm sorry about that. I'm working from home and trying to manage technology on my end, but thank you all for joining us. We'll step back just a little bit and kind of restart our conversation. Dr. Patel is a board certified psychiatrist here at Kelsey-Seybold. He works with our Kelsey Care Advantage members. So some of you who are joining us today may already know him. He's a wonderful addition to our Kelsey team, and we really appreciate you taking the time to talk with us today, especially with everything that's going on with COVID-19. During the pandemic, mental health is just as important as physical health. So our marketing team is super excited that we have you here today and we can have this wonderful conversation with you. We've collected some questions to sort of ask you. I know a lot of these you've been seeing during your practice as you're seeing patients in the clinic. So before we get started, can you tell me a little bit about how your practice has changed now that we're in the middle of the COVID-19 pandemic?
Yeah, so very good. Thank you for that introduction. Our practice has changed to where we are now doing 100% virtual appointments. What virtual appointments would entail is we can do a video session similar to this using our Epic interface. And it's about 45 minutes to an hour, just a discussion, getting to know you. And then at the end, we talk about treatment options and plans. For follow-ups, we are doing both the videos as well as the telephone. So I understand with technology, smartphones, smart apps, sometimes it's hard to get in touch with a provider. So we are also using the telephone for some of our, our Kelsey Care Advantage population.
That's awesome. So as we're seeing an increase in video visits, we know that stress levels are also rising with this pandemic. I know mine has been high, being home, managing working from home, and family dynamics. I'm sure most of our attendees are in a similar situation where these are uncharted territories. Can you tell us a little bit about how our body is responding to this newfound stress during this time?
Right, very good. So that's a great question. You know, the stress, we all feel it. Stress is a natural phenomenon. It happens whenever you feel a perceived threat. So for example, the example earlier with the lion or the tiger in the room, or, you know, an intruder, you get sweaty, shaky, it gets hard to concentrate and focus. And then also you might notice like your heart rate, your breathing rate increase. And so the main thing is just to be cognizant that we are all having similar, things going on, but kind of how to channel that energy or how to release that stress is important.
Do you have any tips for releasing that stress during this time?
Yeah, so there's a lot of good options out there. We call them behavioral activation or relaxation techniques. So one of them is actually exercise. Exercise is great. And I know for our Kelsey Care Advantage, they do have the silversneakers.com access. So there's a lot of home workouts, home programs you can do, walking in parks, nature around the neighborhood. Pets is another good way to relieve stress, both dogs and cats. Horses, if you have access to them as well, but dogs and cats are a good way to relieve stress, walking them, playing with them. Also doing meditation. So with meditation, it works on your breathing to kind of help reset the mind. Doesn't necessarily get rid of everything, but it helps to release the weight of everything all at once. And it can also improve your concentration. And then yoga is another option, which can be done at home. And it's kind of a combination between exercise and meditation.
Awesome. So we talked a little bit about stress, but what about anxiety? So if you feel yourself getting tense or worked up, your heart rate rising, is that stress due to the COVID-19 pandemic, or is it like an actual anxiety or panic attack? So how can we sort of differentiate between those two situations?
That's a good question. So stress is sometimes like the building blocks to an anxiety or a panic attack. So stress is when you may notice, that uncomfortable feeling in your stomach, get a little sweaty, you may get a little irritable or short, with others. That can sometimes be your body reacting to stress, as well as like heart rate going up a little and the breathing rate going up. Whenever it's an anxiety or panic attack, it's kind of like a 10 out of 10. So you feel like you can't breathe, you feel like you can't control your breath or your heart, you might have shakes, tremors, you may have a fear of losing control or a fear that you're dying. And so what's important is we work to manage the stress and work on some of the relaxation techniques before it gets to a panic or anxiety attack.
So you mentioned these techniques. So is there a way to treat anxiety without medication? We hear a lot about people being medicated for anxiety and depression. Will these techniques that you mentioned earlier help for in those situations?
Yes, so for those who have more milder to moderate symptoms, doing non-medication options could work. So that's like the exercise. Counseling is another one, counseling or therapy with a therapist. For people who have more moderate to severe anxiety, so for example, panic attacks, anxiety attacks all day and going to the emergency room, if the symptoms are more on the moderate to severe end, then you may need to talk to your primary care doctor or a behavioral health specialist about medications.
We know that you're in the field of psychiatry, so you're definitely a wealth of knowledge about resources available to people for mental health. What should someone do if they think they need to speak with a medical professional due to stress or anxiety during this COVID-19 pandemic, or anytime really?
Well, so there's many options. That's a good question. to get in with someone, whether it be in the mental health field or even just the medical field, a good starting point is always the primary care doctor. Primary care doctors have a wealth of resources, and they can always, if it's a Kelsey-Seybold doctor, reach out to me and I can, show them along the way. Another option is employee assistance programs for people who are working. I know there's a lot of different changes at work and at home. So employee assistance programs or human resources may have options for counseling and therapy. Other options can also include calling the insurance company. Most insurance cards have a member services line, and they may have behavioral health options, available through the insurance line, or they may find them, based on your zip code. And then the other options could be for those that are in college or school age, sometimes student health counseling, student health centers, or even counselors at school. They have resources as well.
Thank you. I think that's super helpful for everyone here. One thing I would like to touch on is if you think you're in the midst of an anxiety or a panic attack, are there any immediate resources available? Is there like a mental health hotline that's available to call where you can get immediate assistance?
Right. So there are several of those, hotlines as well. There is the national, hotline at 1-800-273-8255. That's the National Suicide Prevention Lifeline. But they talk about more than just suicide. So, anxiety or depression as well. There's also hotlines, in Harris County for professionals, and that would be the 713-970-7520. So there are various hotlines available for both, our population, patients, staff, providers out there.
Great, thank you. One of the big things that has been weighing on my mind, and I'm sure many of our participants today as well, is the social connection that we are missing. We're here virtually and we can see people through computers, but how do we mitigate these social distancing guidelines and factors that were so integrated into our lives before the COVID-19 pandemic? We have a lot of people who, miss their grandkids and miss their kids and aunts and uncles and parents and coworkers. Do you have any suggestions for dealing with those feelings of loneliness or isolation right now?
Yeah, that's a good question. A lot of people, especially if you had a routine or you had a certain, person you would see, family, are having difficulty with, the social distancing factors or inability to travel. So the good thing about today's day and age with technology, we do have several video conferencing apps out there. There's this one such as Zoom, but there's also, various other ones through Google and, various companies, Skype, where you can set up a family meeting or a friends meeting and meet all of your, college friends, all of your family members, especially the distant ones. And a lot of times you can even dial internationally. So you could, maybe get a group together on like Friday at 8 or Saturday at 5, and just arrange via emails or text to meet your family and friends that way.
What about parents? We know that parents are also under a tremendous amount of stress right now as they're dealing with social distancing for their kids. A lot of parents have now become teachers with distance learning and helping their children fulfill their education needs at home. Do you have any tips for parents or caregivers to help their children manage the anxiety and stress that children may be feeling from the disruption in their normal routine as well?
Mm-hmm. And that's a good question. Definitely, children, are very bright. Children, teenagers, they can pick up, when something's off or something's wrong. So, main thing with having children or teenagers is making sure that they have a sense of routine. They do well if their schooling is still around the same hours. You can still celebrate birthdays, holidays, parties. It's just their friends may have to dial in rather than come over, for like face to face. Also for parents, if there's a way you can work on reducing the own stress and anxiety before meeting with the children, that can help. because sometimes, if they can pick up on yours and then, you can pick up on theirs, it can kind of become a cycle. So letting them know, this is a trying time for everyone. It's temporary, eventually the world will return to normal. And, just to kind of try to make the most of it, whether it be learning a new skill, finishing all that yard work, cleaning out the garage, there's so many different things, I guess, that could be worked on at home, to help, I guess, distract from all of the disruptions in routine.
So with your virtual visits now, is there a common theme that you're seeing with questions or issues your patients are bringing to you during the COVID-19 pandemic?
Yeah, I mean, I think, it's affected everyone, whether you're working, retired, still in school. And I think the disruptions in the routine is a big question that we're getting, especially with people who are very active, whether it be in church or the senior center or any religious services. So finding a way to keep that routine is important, whether it be dialing in through these video applications or, still working on things that they would work on, but just instead of in a group setting, more one-on-one or just with direct family. I think that's been a big one as well.
We actually have a question that came in from one of our attendees that asked if you could explain how stress and anxiety affects our immune system.
Okay, very good. So stress and anxiety, stress is kind of like the precursor to anxiety. And whenever you're under chronic stress or, having anxiety symptoms, you can have a release of this hormone called cortisol. Cortisol is released from the adrenal glands near the kidneys, but your body releases it in response to the perceived threats. It's kind of like that fight or flight system that where, if your lion is in the room, you either are going to fight the lion or you're going to run from the lion. So same thing when there's cortisol released, in the body, it can affect your immune system to where, you feel you have increased blood sugars, your heart rate goes up, you're having increased, breathing. So it can make you more vulnerable to things like the cold or just other infections. I'm not too familiar with the stress response, and COVID, but I know that it can predispose you to other things like colds and allergies and things like that.
Great. So regarding COVID, do you see any long-term effects that would be positive for mental health practices? Um, I know that some psychiatrists and some practices were already doing virtual visits, but is there anything sort of trending in your field that has sort of come to light because of COVID-19?
Yeah, I mean, I think that across the board, a lot of providers, whether it be psychiatrists, therapists, have been pushing, for virtual health and improving access to care. It's a lot easier to come see a provider if you can do it from the comfort of your own home rather than having to get in a car, go through, certain traffic and then go in and see someone. And especially in today's day and age, preferring to be at home or to be, apart from any places where there might be crowds. So I think, medicine has kind of changed and we will have more mental health resources, I think, down the road where we can access them either over the telephone or over the video conferencing.
Great. So we do have a few more questions that are coming in from our attendees. They're more directly related to COVID-19. One of the questions is regarding everything opening back up and social distancing guidelines being relaxed. Stress levels for certain people who have anxiety will probably go up during that time. So how can you navigate keeping your stress levels and anxiety low as you start to increase social participation again?
Well, yeah, that's a good question. Whenever this things are opening up, slowly, piece by piece, and if you're noticing in certain situations, it feels new or worried, right, about exposure risk, working on those techniques, whether it be the deep breathing, the meditation, Also, it's okay to feel anxious. It's okay to feel stressed. Those are very natural emotions that, you know, a lot of people are having at this time. So if you are having them, just notice the triggers, whether it be standing in lines, going to grocery stores, you know, whichever it might be. And there may be ways you can mitigate them, like going with a family member or sending the family member or getting some stuff delivered, you know, so there might be workarounds to help manage the anxieties so you don't have the same triggers.
Great. Let's see. We have one other question that just came in that I think is important to answer. Taking into account that the information we're receiving about coronavirus says we should stay home, wouldn't it be better for our mental health if we were outside getting some fresh air and sunshine, as long as we adhere to the social distance guidelines?
Right, and that's kind of going along the lines of the exercise. So whenever you're exercising, it is, you know, you can exercise for so long in your living room or your garage, but if you're out on your backyard, patio, porch, balcony, those should be okay. And then especially if you're going to like around the neighborhood or into a neighborhood park, just making sure, you know, most playgrounds are closed off, but you're not touching anything and you're not getting too close to anyone. Most parks do have signs, you know, to maintain that 6 feet distance while you're walking or riding your bicycle or jogging.
We did have a question that came in, and I wanted to confirm this with you, that at this time you are only seeing Kelsey Care Advantage patients, Kelsey Care Advantage members for patients, correct?
Yeah, so at this time, behavioral health is only seeing Kelsey Care Advantage. Although I do work with primary care providers at Kelsey-Seybold to find resources for non-Kelsey Care Advantage. So the primary care providers should have the resources, you know, at their disposal as well.
Great. Thank you for clarifying that. We had quite a few attendees who raised their hand to ask that question or submitted it in our question and answer section at the bottom. If you do have a question for Dr. Patel, we have a few more minutes, but we'll be on today. So please feel free to submit them through the question and answer box that's at the bottom of the Zoom screen. That makes it easy for us to keep track and see and keep them in order and make sure that we get as many questions as possible open. Okay, we have one more new question that came in. The fear of COVID-19, is it normal, excessive, or phobia-like? And how can you tell if the fear that you're having is something more than what is sort of standard for everyone during a pandemic?
Okay, so that's a good question, by the way. So the fear of COVID, COVID in this case is going to be like that lion or that tiger example. You know, you're in the room. Obviously, we all know COVID is an infection and it can affect everyone differently. So some, you know, can get it and do well. Some can get it, may end up in the hospital. So if you feel like the worry or the fear of getting the illness is getting into like your ability to eat, your ability to sleep, your ability to function either at work, at school, things like that, then it may be time to talk to someone, either your primary care doctor or a counselor, or, you know, a mental health specialist, if you feel like it's interfering with other domains. So for example, like your ability to eat, sleep, concentrate, focus on work, and those kinds of things.
We had another question that came in about resources for meditation. Do you have any apps or websites that would guide you through meditations that you would recommend?
Yes, so I've actually been working in meditation myself. You know, it is a trying time for everyone. So the meditation apps that I have exposure with, there's one, Calm. That's an American-based one, CALM. Headspace is another good one. They're, I think, UK-based. And on YouTube, there are several guided meditations, which are completely free. One of them is by individual Jason Stevenson, And so he has some pretty good guided meditations. And then the fourth resource that I use is one called Palouse Mindfulness. It's Palouse mindfulness.com. And they have a program you can work through to help meditate and, help to reset that inner balance.
Great. I've personally used the Calm app as well, and I enjoy it. My kids have used it as well. Meditation is something that I've started practicing as well, and I 100% agree with you. It's definitely something you need to practice. I know I felt very awkward doing it at first. So do you have any tips for those who would be starting out meditation and maybe felt awkward like I did as well in the beginning?
Right. Yeah. So it's always, the first time it can always be a little like nerve-wracking or a little nervous, because if it's something you've never done before, you're not sure what to expect. But the main thing is just to work on the breathing. A lot of these apps do have guides. So what a guided meditation will be is there's a voice that tells you kind of how to do it. And it's okay to have the thoughts and the feelings that you have. So the thoughts may be going 100 miles an hour. They might be going 1,000 miles an hour, all over the place. Like, what about bills? What about this? What about that? And so just, with practice comes experience. And so just if you feel like the first couple of times doesn't go well, it's okay to, redo it. I would recommend doing it somewhere where you can have a little bit of peace. So for example, if you are able to get to like a garage, or if you have someone to watch the children, or the children can get their own meditation, at the same time, because it's hard to do a meditation if you have, interruptions every 5 to 10 seconds.
Yes, I agree. I have to most certainly separate myself from my kids when I try to meditate. Another question that came in that I thought was very interesting. Are there any supplements that you would recommend to your patients to help with mental health and mental clarity during COVID-19?
Well, so with supplements, a lot of supplements are FDA approved, in terms of having those trials like our medications would have. So in terms of supplements, there, I think a good multivitamin would be good, just so that way, depending on your diet, you still have all of your nutrients. But in terms of like memory, getting with a neurologist, that could be important. And I think overall, either working with your primary care doctor or, your psychiatrist or your therapist would be just as important, I think, as any supplement.
Another question that came in that was, I think would be helpful to answer for everyone is, when you go to the grocery store and someone does not abide by the 6-foot social distancing guidelines, how do you handle that situation? Do you have anything, it could be very awkward to ask someone to back up. So do you have any suggestions for dealing with that situation?
Yeah, so if someone is, I guess kind of encroaching or not following that 6-foot recommendation, you could always let them know that, excuse me, sorry, excuse me, ma'am. I'm trying to keep this distance because, we're here in Harris County in Houston, we're trying to keep the numbers down. Also, I'm trying to do this for a family member. I'm trying to stay safe so nobody at home, gets sick. If they're still encroaching, you can always leave the situation, order it online or come back later to get the item, or let a team member or a manager know, if someone is kind of all over the place.
Great. And then I know we're getting close to wrapping up here. You have patients to see this afternoon as well, but we did have one other question that came in. What is the difference between anxiety and depression, and how should I handle depression during this time?
So that's a good question. So anxiety and depression are very similar. They're kind of like close cousins. Anxiety can be where you worry so much that you can't concentrate, you can't sleep, you can have irritability and trouble relaxing. And depression can be more when the mood is feeling sad, down, or depressed, you give up your friends, your hobbies, you have poor sleep, poor energy, and poor appetite. And with depression, there can be thoughts of wanting to die or suicidal ideation. So if you're feeling any of those, definitely let your primary care doctor know. Let someone know. If it's any suicidal ideation, you can always call that 1-800-273-8255 or even 911. But coming back, yeah, so depression, it can be very common with anxiety, and ways to manage it would kind of be those behavioral activation techniques, as well as therapy with therapist and medications if warranted.
What sort of medications do you prescribe for anxiety or depression? I think that's something that most people would probably want to know as well.
Okay, that's a good question. So in terms of anxiety and depression, the good news is a lot of the medications are the same. They work on the serotonin. They're called serotonin selective reuptake inhibitors. And so they increase this neurotransmitter in the brain. And they do take about 4 to 6 weeks to get a full effect. So I think that's the other thing with medications is sometimes people may take it and want that immediate response, but it does take about 4 to 6 weeks to get a full duration of effect.
When you begin taking medication in that interim period of the 4 to 6 weeks before the full effects start kicking in, is there anything you can do to sort of help yourself get through that time?
Yeah, so in that 4 to 6 week period, some doctors, they do use medications like propranolol, which is a blood pressure medication, or a benzodiazepine to help with anxiety attacks. Other things we can do while waiting for the medication to work is therapy. And so therapy is when you're coming in or meeting someone digitally and discussing different thoughts, emotions, and actions that you're feeling. And so what therapy does is it works on whenever you are feeling depressed or anxious, catching what's all going on, and then seeing if there's any factors that can be modified to help prevent future depression or future anxiety.
Great, thanks. I think that's important to clarify for everyone who's here and provide all of our attendees with that information as well. We are going to start wrapping up our conversation today, but is there anything else that you would like to leave with our attendees regarding mental health during COVID-19?
Yeah, I would just like to say that, this is a time, that's different for all of us. We've never had anything quite like this, before, but it is temporary. We just don't have that end date. And so I know we're a very resilient bunch with Harvey and overcoming so many various things, in the last 10, 15, 20 years. And so this will just be another one that 5 years, 10 years, or, even 6 months from now, we might look back and be like, yeah, I remember that time, but we made it through. So just try to look forward to, those future goals and those future plans.
Thank you. Well, we're going to go ahead and wrap up. Like we said earlier, I know you have patients to see this afternoon as well. So thank you so very much for taking the time to join us this afternoon and talk about mental health. If you missed our discussion on Wednesday with Deb Kern, PhD, we touched on mental health and stress a little bit during that conversation as well. That chat is available on our Kelsey-Seybold website on the CareConnect page, and it's also available on our Facebook page. So if you have any further questions, or if you need to come back and take a look at the resources that Dr. Patel mentioned today, you can go ahead and look at that on our Facebook page. And the conversation from today will also be posted on our CareConnect page in a few days. So if you are new to joining us today, thank you so very much for joining us and staying connected with Kelsey-Seybold during this COVID-19 pandemic. We will be continuing our CareConnect conversations next week. Our focus is going to shift a bit next week. We're going to be focusing on pediatrics. So Wednesday and Friday next week, we'll be chatting with Dr. Kimba Black, who is a pediatrician at Kelsey-Seybold, and Dr. Melanie Mazoon, who is our pediatric hospitalist for Kelsey-Seybold. So if you have children or if you're a grandparent and you're interested in learning more about how this COVID-19 pandemic is impacting kids, please go ahead and sign up for that conversation, and we'd love to have you join us next week. Until then, I hope everyone has a wonderful afternoon and a great weekend. Hopefully the weather will stay nice here in Houston and we can all get outside for a little bit. So thank you again, Dr. Patel, for joining us, and have a great afternoon, everyone.
Thank you. Have a good day.